some other health programs. Now, tuwan-tuwa na yung mga midwife namin. Dahil sa isang pagkataon lang, in 1 month, tapos na yung problema nila sa isang taon. Second, with the 4Ps, kasama na yung health at saka education program. Obliged sila. Kung hindi sila nagpa-konsulta, kung buntis sila, kung hindi sila nagpa-immunize, bawala yung 500 nila a month. So merong, one way of inspiring them. It's not actually bribery, pero sa palagay ko, it's one way of inspiring them to focus more on health and education. So, I was taking also advantage of this opportunity. Now, with these 2 programs in my town, this could transform the behavior of our people. Although, hindi naman tremendous na biglang nagbago dahil changing behavior is really difficult. Actually, that was the most difficult task I had encountered in my 21 years in service. Mahirap baguhin yung tao, yung attitude talaga. Kung mamadali pa lang yan, siguro mayaman ang Pilipinas ngayon. Totoo lang.
Good morning, sir. I'm Claire from Unilab. In your earlier slide, you mentioned that one of the problems that you have identified is the prevalence of preventable diseases in your area. With your program, nagbago po ba yung statistics? Meron po bang because of the, yes. Because may compliance rate na. And then the second question is, you've also mentioned about helots. So I'd like to find out the maternal and child mortality rate in your area.
Wala. Doc, ikaw na bahala sa maternal death. Wala ako record dito. Pero sa health outcomes, during the presentation sa Galing Pook, kasama po yun sa presentation ko, by the way. The leading causes of mortality in my town, the highest is in pneumonia. Before the program, our death was 174. Now with this program, that was 5 years with Bishop, because if we move forward for 7 or 8 years, we cannot move backward with 7 years also, because the record was not really in order before my time. So we can move only 5 years before and 5 years with the program. So pneumonia was 174. With the program, it went down to 106, yung mortality. So at least nag-reduce na mga 60. Tapos yung cardiovascular disorder, yung second naman, is from 112 to 91. Tsaka yung cancer is 60 to 38. PTB, diarrhea, and neonatal, very minimal lang po yun. For health outcomes, again, for morbidity, our number 1 is URTI, upper respiratory tract infections. So we have 3,566 before. It went down to 3,176. But for pneumonia, for morbidity, from 3,103, it went down to 1,252. So laki ng drop with the program. And for diarrhea, ito lang umakyat. From 168 to 580, siguro gusto nila pumunta sa sentro dahil meron ng medicines available for diarrhea. Baka siguro before ABC lang sila eh. Herbal lang sila dati. So that's why it went up. I hope that answers your question.
Thank you, sir.
Thank you.
Good morning, sir.
Morning.
I'm Harvey from the Ateneo School of Medicine and Public Health. First, I must say that what you and the people of Bindoy has done is really amazing. And if you could only replicate this in other municipalities, then it's really something that will be very helpful for the health status of our country. But my question is this. I'm sure you will agree with me that the success of this program depends very much on your support.
Yeah.
I mean, in any LGU, whatever program you want to implement, it will depend on the leadership, on the mayor, on the vice mayor, the counselors, etc. So, what happens when you are no longer vice mayor or mayor of Bindoy? How do you ensure that even after your leadership, this program will still stay in Bindoy that will continue to benefit the people of the municipality?
Yan sinasabi nila, may opportunity, may threat rin, di ba? May strength at saka weaknesses yan. Anyway, palagay ko naman, I think this will sustain kahit nawala na kami. Because people love the program already. And those who wanted to succeed have to see to it that the good programs will be continued. Otherwise, palitan sila. Second, kaya tinatawag siguro to health is power. Because we're able to win for several elections kahit lugi kami sa pera. Alam mo, for several elections, mas mayaman yung kalaban namin. Sa totoo lang. They were spending more than twice what we have. But in spite of that, we're able to win. That's why we are still serving our people. Kung hindi, umalis na ako sa stage. After the election in 2007, ang dami namang, yung mga LHP mayors were so frustrated. You know why? We tried our best. Binigay namin lahat sa kanila. Pero at the end of the day, you know, on the election day, nakita mo yung mga taong tinutulungan mo, dahil several pesos lang or 500 pesos lang, nasa kabila na. Very frustrating. So during this psycho-spiritual retreat, nabunutan kami ng tinig. Conducted by Ateneo. We were very happy for that retreat dahil siguro it would have changed our attitude also. We were able to realize that we still have to go on because that is one reason why we won, because there are still some good people who deserve to be served. Because sabi nga nila, evil men flourish because good men do nothing. So that's why we have to continue hanggang sa kailan nila gusto. Ayaw ng anak ko pumasok pa sa politika. Actually, dalawang anak ko nasa stage na eh. There are nurses. Yung isa ko, he is now my secretary, is also taking up her nursing. So my wife is a nurse, ako ay bubuhayin sa nurse. Pagdating ko sa States, I'll have 4 nurses actually. And I have 3 sisters in the States.
Thank you, sir.
Good morning, everyone. I'm Johnny Manuel Gonzalez of Microinsure Philippines. Taking it in the perspectives of transformation, I'm just curious. You said if I were to understand the whole point of the whole scenario of the talk, it's using health's power in transforming the lives of people.
Yeah.
Did it really serve its purpose? And then, the follow-up question is, na-inculcate ba talaga sa puso't isipan ng ating ating mga kliyente or to the people we serve the importance of health? Thank you.
Yeah, because the program has been there for 8 years now. And I think pumasok na rin sa puso ng mga tao after 8 years. Isipin mo naman, ang tagal na yung program na yan. Kung hindi pa sila nakapacitate with what we have done, with the increase in counterparting that they have to give, talagang mahinto na yung iba. Although there are some who really stop. There were some who really refused to continue because they have also several years of non-payment. In other words, we always require them to pay back what they have not paid the previous years because it will be very unfair for those who have been very diligent in paying and continue with the program. If they will just say, forget the past, we'll just enroll in the present new counterparting scheme, that will be unfair. So I told the midwives, we have to very strict with our policies. Otherwise, if we try to bend, wala. So, nasa political win rin yan. Kung hindi sila bumoto sa akin, okay lang sa akin, bahala na sila. Importante dyan, the program will stay, it should be sustainable. Because we believe in totality, we are serving majority of the people.